Once upon a time, Earth was a beautiful place to live. A stunning planet with shades of blue, green, and white floating through space. It was the right distance from the sun to become home to millions of different forms of life, all connected in amazing and unexpected ways. Much later, a new species appeared, not very fast or strong, but with a very big and complex brain. Yes, the newcomer was human, and now we are responsible for taking care of the earth. Even if we cannot keep the earth in its original state, we should try to avoid causing more harm. That's why planetary health, bioethics, and climate change have become prominent topics in global discourse. Recognizing the complexities of these challenges, experts from a wide range of disciplines are collaborating to find solutions that ensure the planet remains healthy and livable, not just for humans, but for all life that calls Earth home. Recently, a distinguished group of academics, health professionals, historians, and community activists gathered at the Monash University Prato Center in Italy. Under the leadership of Professor Warwick Anderson, Professor Jacqueline Troy, and Professor Tony Capon, they examined into the issues surrounding climate change and explored opportunities for advancing planetary health. The three-day workshop proved to be highly productive, concluding with plans for future research and scholarly writing based on the collective insights of the participants. There is also a planned follow-up workshop in Australia aimed at engaging with remote indigenous communities. Let's hear some reflections from the participants.
I'm Ross Upshur. I'm a professor at the Dalla Lana School of Public Health, where I hold the Dalla Lana Chair in Clinical Public Health. I am so pleased to have been able to participate in this workshop on planetary health ethics. It was a really remarkable group of scholars from across many disciplines and from around the world, where we started to engage in and structure arguments for the overarching importance of ethics in any discourse around planetary health and climate change. I think one of the key elements coming out of this workshop will be the move to reframe, redefine, reconceptualize bioethics, in some ways reaching back to its early roots as the more broader concern with the ethical implications of humans and their interaction with nature and the environment. But also I think it has a tremendous opportunity to influence education and policy making. So I think this is a transformative moment, and I hope that the results of the Prato meeting, including the Prato Declaration, will have resonance and importance beyond just the 2 days that we've been meeting here.
Hi there, my name's Julian Sheeler, and I'm here representing the World Health Organization in some ways. And I just want to say this has been an extraordinary rich a time. I came here very interested in ways of bridging my understanding of medical and applied ethics and applying and extending that into the environmental challenge, the planetary challenges we are facing, and to listen to so many different perspectives, to hear from indigenous peoples, to hear from anthropologists, sociologists, people from a huge variety of perspectives, has been enormously enriching, and it's kind of helped me take a few steps forward, which has been wonderful.
I'm Professor Jacqueline Troy. I'm the Director for Indigenous Research at the University of Sydney. I'm Ngarigu of the Snowy Mountains in southeastern Australia. I'm here in Prato at the Monash campus with a group of scholars from all around the world, and we've been talking about planetary health and ethics. And one of the things that we have particularly focused on, which has pleased me greatly, is how Indigenous people might be included in these conversations about ethics and bioethics. I also really enjoyed the idea of transdisciplinary research. We were thinking about using our disciplines to work together, not just in an interdisciplinary way, sort of keeping our own disciplines, but thinking about what it is to use other people's disciplines and their thinking to put a lens on what the future of the world will be in terms of its health overall. I particularly enjoyed also being at this event with other Indigenous people and people who work with Indigenous communities all over the world.
Hello, I am Professor Emma Koval. I'm a Professor of Anthropology at Deakin University, and I'm so pleased to be part of this Planetary Health Ethics workshop in beautiful Prato at Monash Prato in Italy. I have so much enjoyed this workshop so far. It's been on my mind for many years as an anthropologist that works within Indigenous health and also within medicine and health research. That we kind of act as if we don't live on a planet in many of our everyday lives, and particularly within health. And I think planetary health ethics, or whatever comes out of this workshop, will be a really important step in changing that, and I'm really proud to be part of it.
I'm Tamara Lucas, and I'm attending the Planetary Health workshop on ethics here in Prato. And the question about interdisciplinary collaboration and why and how this can help planetary health really interests me. I think it's very important to have a multiple group of disciplines involved, because different ideas and different perspectives come from different ways of being educated and different ways of seeing and different knowledge, different literatures. And that really comes through with how people are addressing these big intractable problems, and that leads to creative solutions. So the interdisciplinary nature means that we're learning from areas about which many people in the group don't know about, because we're sharing knowledge to address the same issues, but coming at these big intractable problems from lots of different angles. So that feels very productive, and while we're all learning, we're also seeing things in different ways and gaining new perspectives on the same issues.
My name is Verena Wild. I'm from the University of Augsburg in Germany. I'm a professor of medical ethics there, and I was fortunate to be invited here to the workshop on planetary health ethics in Prato. It's absolutely wonderful to be here and to meet so many wonderful colleagues who are so dedicated to this topic. You can really sense the urgency of the things that we're talking about, the harm that's being done to the planet and to everyone living on it, and the injustices that are being done. And there's a lot of engagement here, a lot of dedication to develop some thoughts. We have the time here. We can really sit down and speak, exchange, listen to others, learn new things. And there's really time to give this thought, and that's wonderful, because usually we have these very days full of many tasks, and this year is a very special moment, very special 3 days, in which we hope that we can develop something that will change something, improve something for the better.